Exhibitionistic disorder represents one of the most complex and misunderstood conditions within the spectrum of paraphilic disorders, characterized by recurring and intense sexual arousal from exposing one's genitals to unsuspecting strangers. This psychological condition extends far beyond simple attention-seeking behavior, encompassing a deeply rooted pattern of sexual gratification that significantly impacts both the individual experiencing it and the unwilling observers who become inadvertent participants in these episodes. The manifestation of exhibitionistic disorder typically emerges during late adolescence or early adulthood, though the underlying psychological foundations may have been established much earlier in an individual's development. Those affected by this condition experience persistent urges to expose themselves in public settings, often deriving intense sexual excitement from the shock, surprise, or distress of their unwitting audience. The behavior is not merely impulsive, but follows a calculated pattern where the individual actively seeks opportunities to expose themselves while maintaining some degree of safety from immediate consequences. Understanding exhibitionistic disorder requires examining its complex etiology, which appears to stem from a combination of biological, psychological, and social factors. Research suggests that neurobiological abnormalities, particularly in areas of the brain responsible for impulse control and sexual behavior regulation, may predispose certain individuals to developing this condition. Additionally, childhood experiences of trauma, abuse, or inappropriate sexual exposure can create psychological vulnerabilities that manifest later as exhibitionistic tendencies. The disorder often coexists with other mental health conditions, including anxiety disorders, depression, and substance abuse issues, creating a multifaceted clinical picture that requires comprehensive treatment approaches. The diagnostic criteria for exhibitionistic disorder, as outlined in psychiatric literature, specify that the individual must experience recurrent and intense sexual arousal from genital exposure to strangers over a period of at least 6 months. Furthermore, the person must have either acted on these urges with non-consenting individuals or experienced significant distress or functional impairment due to these fantasies and urges. This clinical definition helps distinguish between exhibitionistic disorder and other forms of sexual expression or occasional inappropriate behavior that might occur under specific circumstances. The psychological profile of individuals with exhibitionistic disorder reveals interesting patterns that contribute to our understanding of this condition. Many affected individuals report feelings of powerlessness or inadequacy in their daily lives, finding temporary relief and a sense of control through their exhibitionistic acts. The element of risk involved in potential discovery often amplifies the sexual excitement, creating a powerful reinforcement cycle that makes the behavior increasingly difficult to control. Interestingly, most individuals with this disorder do not seek further sexual contact with their victims, distinguishing exhibitionistic disorder from other predatory sexual behaviors. The impact of exhibitionistic disorder extends beyond the individual experiencing it, creating significant distress for unwilling observers and broader social consequences. Victims of exhibitionistic acts often report feeling violated, anxious, and unsafe in public spaces, particularly in locations where they previously encountered such behavior. The psychological trauma experienced by witnesses, especially children or vulnerable individuals, can be substantial and long-lasting, highlighting the serious nature of this disorder beyond its classification as a mental health condition. Treatment approaches for exhibitionistic disorder have evolved significantly over recent decades, moving away from purely punitive measures toward comprehensive therapeutic interventions. Cognitive behavioral therapy forms the cornerstone of most treatment programs, helping individuals identify triggers, develop coping strategies, and modify the thought patterns that contribute to their exhibitionistic urges. Behavioral modification techniques, including aversion therapy and desensitization procedures, have shown promising results in reducing the frequency and intensity of exhibitionistic impulses. Pharmacological interventions also play an important role in treating exhibitionistic disorder, particularly in cases where the condition is severe or resistant to psychological treatment alone. Selective serotonin reuptake inhibitors have demonstrated effectiveness in reducing sexual obsessions and compulsions, while anti-androgen medications may be prescribed in extreme cases to reduce overall sexual drive. The combination of medication and therapy often produces the most favorable outcomes, though treatment success varies significantly among individuals. The prognosis for exhibitionistic disorder largely depends on several factors, including the individual's motivation for change, the presence of co-occurring mental health conditions, and the availability of comprehensive treatment resources. Early intervention typically leads to better outcomes, as established patterns of behavior become increasingly difficult to modify over time. Support systems, including family involvement and peer support groups, can significantly enhance treatment effectiveness and long-term recovery prospects. Legal considerations surrounding exhibitionistic disorder present complex challenges for both the criminal justice system and mental health professionals. While exhibitionistic acts constitute criminal behavior in most jurisdictions, there is growing recognition that purely punitive approaches often fail to address the underlying psychological causes of the behavior. Many court systems now incorporate mental health evaluations and treatment requirements into sentencing decisions, acknowledging that effective rehabilitation requires addressing both the legal and psychological aspects of the disorder. Prevention strategies for exhibitionistic disorder focus primarily on early identification and intervention for at-risk individuals. Educational programs that promote healthy sexual development and provide information about appropriate sexual expression can help prevent the development of paraphilic disorders. Additionally, trauma-informed care approaches that address childhood experiences of abuse or neglect may reduce the risk of developing exhibitionistic disorder and other related conditions. The social stigma associated with exhibitionistic disorder often prevents individuals from seeking help until their behavior has resulted in legal consequences or significant personal distress. Public education efforts aimed at increasing understanding of this condition as a treatable mental health disorder, rather than simply criminal behavior, may encourage more individuals to seek voluntary treatment before their actions harm others or result in legal problems. Research into exhibitionistic disorder continues to evolve, with scientists exploring new treatment modalities and gaining deeper insights into the neurobiological foundations of the condition. Advances in brain imaging technology have revealed important information about the neural pathways involved in impulse control and sexual behavior, potentially leading to more targeted therapeutic interventions in the future. The complexity of exhibitionistic disorder underscores the importance of a multidisciplinary approach to understanding and treating this condition. Mental health professionals, legal experts, researchers, and community advocates must work together to develop comprehensive strategies that protect public safety while providing effective treatment for affected individuals. Only through continued research, education, and compassionate intervention can we hope to address the challenges posed by exhibitionistic disorder and similar conditions that impact both individuals and society as a whole.